According to the World Health Organization, it is estimated that over 1 million people globally contracted HIV in 2023, a reduction of 39% since 2010. Despite advancements in testing and treatment, many countries, including South Africa, are still dealing with high numbers of HIV infections. Now, to prevent HIV infections, over the years, new interventions have been introduced, including the use of pre-exposure prophylaxis choices for HIV-negative persons at risk of HIV infection. Now, used alongside other protective methods such as condoms, as part of a comprehensive combination with clinical treatment guidelines, PrEP has clinically shown to have great potential to reduce the risk of contracting HIV infections. Now, to talk more about access to pre-exposure prophylaxis or PrEP treatment in South Africa, we're joined by Doctor Musa Manganye, who is the Director for HIV Treatment at the Department of Health. Dr. Manganye, pleasure to have you. Thanks very, very much for joining us.
Thank you, Leanne. Good morning. Thank you for having me, and good morning to the viewers.
Let's talk a little bit more about PrEP before we get into how it works, when people should have it, and all of those things. Perhaps you can give us a little bit more info on PrEP.
Well, to provide some context, Leanne, PrEP, as you rightfully said, when you provided the context, has been initially implemented in South Africa in 2016. That's when we launched our guidelines for the implementation. And in this case, the focus has been largely on the oral PrEP, which is the two-pill combined ARVs that are given to the HIV clients that are actually having the potential or the risk of being infected by HIV. So it prevents them from getting infected. So this pill is taken on a daily basis. Of course, upon the initiation, the 1-month prescription is provided so that it assesses the further assessments that needs to be done to a client to ascertain the level of risk, and some of the counseling and education that needs to be provided to make sure that clients are able to really stay free from being infected. So far, by August this year, we have enrolled over 1.6 million clients on PrEP, and that's really a quite significant number, although we would have want to really up the scale, but it's not moving at a speed that we expect. Yeah. Of course, we still continue to ensure that we engage on the demand creation for the PrEP use.
So in terms of receiving it, how crucial is it for a person to take an HIV test before starting the PrEP?
Say that again, Leah.
In terms of testing for HIV and then taking and starting PrEP, how crucial is that?
It's very crucial. That's part of our procedure. So any client that needs to uptake on the PrEP has to via the HIV testing first. This will be to ascertain the negative status, because if you are negative, then you become eligible to actually enroll on PrEP in particular. So any PrEP that is instituted without any test may suggest a different efficacy, because it will not really use to the level that is expected in particular.
Okay, so when a clinician is considering approving PrEP for somebody, what do they take into consideration?
Firstly, you need to undertake the risk profile kind of assessment that needs to be done. This is to ascertain the level of risk to the client that is approached. You need to determine whether the client is, of course, sexually active or may actually suggest themselves to be at risk of being infected. So anyone who would ask for that would not be declined, but of course we need to make sure necessary procedures are done, such as the testing, the counseling, and making sure that there is an understanding on the essence of taking the pill every single day. And one thing that we would like to emphasize is the fact that for a PrEP to be effective, it needs to be taken consistently over 7 days. Then that's where it begins to actually take effect. And of course, we encourage that the adherence on a day-to-day basis must be done.
Yeah. So what are some of the PrEP preventable choices that are available in South Africa?
Well, currently we have the oral PrEP, which is currently being optimized.
Yeah.
We recently have had the approval of the CAB-LA, which is the cabotegravir long injectable, the PrEP use that is going to be piloted in the country. We have received about 231,000 doses from the US government, PEPFAR, to ensure that we begin to really maximize the prevention in particular. So this is the two that are currently available, but it is not part of the guideline yet. However, the SAPRA approved that so that it is safe for use. We still have to ensure that the NEMLEC is able to really enter that as part of the essential drug list so that it is able to be procured for use. We understand there is issues of cost involved in that space because it is very much expensive compared to the oral PrEP that we currently have. So these are the two that we have in particular. But we are also beginning to do some studies on the lenacapavir, which is this a 2 6 months injection. It's part of the long injectables as well. But this is far from consideration, especially in terms of the use, because there's so much of the consideration that we must do as a country to ascertain the availability and the approval for use in the country.
Okay, so I was about to ask you, I mean, is it available in South Africa, what you're talking about, lenacapavir?
Not as yet.
Not as yet, so there's still a lot of work going into that, because that would be, I mean, I know it's a breakthrough and I know that it's said to be revolutionary, but we wait on that one because I think it will be, I imagine, a great turning point for those that do have HIV. So we'll wait on that and hope for the best on it. In terms of some of the myths and misinformation that's doing the rounds on PrEP, perhaps you want to highlight some of those in case people are worried, thinking, no, I'm not going to take this. What do you commonly hear?
Well, in most cases, we would hear people saying, you know, when you take PrEP, it will prevent you from STI, and it also help you prevent from the pregnancies. And by right, and it has been asserted with, you know, research and evidence that PrEP does not prevent the STI and it doesn't prevent the pregnancy. That is why it should be used to prevent the HIV acquisition for those who are HIV negative. And that is why we further emphasize the essence of the combination prevention measures. So therefore, a PrEP alone may not be effective. It needs to be combined with other prevention measures, such as the use of condom. And in that space, we're able to really assert the reduction on the new HIV infection that we currently have as a country, with over 150,000 people that are infected every single year. That's quite high. So, but with this, it has proven that it really can reduce drastically the new infection. But we also have instances where others would think a PrEP is a contraceptive. It's not a contraceptive. So that is why we also encourage that when you are using PrEP, you also continue to undergo the family planning services so that you're able to decide, and the health providers are able to help you choose the applicable option that would actually help a woman not to actually fall pregnant unless they have actually proposed and planned for. So those are some of the myths that we tend to see that our people are here are saying every single day. So we encourage that we really guard against those. We have materials that are available. It's also available on websites such as myprep.co.za. It has almost every frequent asked questions, all the myths that we can actually demystify.
All right. Well, there you go. Thank you, Doctor. Thank you so much for updating us on that. And also just, again, a very important point to end on here. not a contraceptive. So condom use is still absolutely the way to go in terms of protection in every sense of the word. Dr. Musa, thank you for talking to us. Dr. Musa Manganye is from the Department of Health's Director for HIV Treatment. He was talking to us about interventions being put in place to prevent HIV infections, including the use of pre-exposure prophylaxis treatment.